storied history of organizing and community building. And I want to get a sense of where you've come from to be where you are now. And then we'll go into how that informs what you do and your attitude and your urgency in explaining and encouraging our people to address the impact of COVID-19.
Sure. I come out of the Midwest, Kansas City, Missouri.
That's my home. And
Harry is from
right. Kansas City. Harry's from St. Louis. So we're
all
Missourians.
Very nice. Very nice. And so, you know, I come from a family where my father was in the military, but was disability retired in his 20s because of a heart condition. And my mother wasn't a licensed practical nurse. And they struggled to make ends meet, but they found enough money to send me to school, private school. So I came through that era where they started busing, and my families took me out of public school and put me in private school. So I got to see both worlds.
Where'd you go, Rockhurst?
I went to O'Hara High School.
I didn't know about that one. Okay.
Yeah, right
back in my day, day was Rockhurst.
Yeah. My sisters went to Hogan.
Okay.
Hogan.
All right.
Yeah, and so I got to see both worlds. I got to see what opportunity looked like, and I got to see what it looked like to have fun without having a lot of money, but to have the support and love of a family. So, you know, my days were spent playing, riding my bike, playing with my BB gun, running up and down the streets where you could still do that. And I got out of that space by actually joining the military when I was 17. There was a program called the Simultaneous Membership Program that if your parents would sign for you that junior year, that summer, you could go to basic training, come back, you're in the reserves, and then you finish college, you do your advanced camp, and then you could go on. So I went on through ROTC and found my way to college, really not knowing what I wanted to do. And after college, after trying to sell life insurance and selling it all to my family and then having no one else to sell it to because I wasn't a good salesperson, worked at the Sprint call center. And then I decided I would just go for it. And I decided I was going to start my own foundation and I could sniff out money and power. And there was a Jesuit priest at Rockhurst College named Father Thomas Savage and an amazing woman on the city council named Joanne Collins. Those two folks took me under their wing. They introduced me to a woman named Jan Kramer at the Greater Kansas City Community Foundation. And that is actually how my career started. Working at the nexus of money and power, applying it to people's charitable interest. And from there, I went to run a nonprofit intermediary and got ran out of Kansas City. And I got ran out of Kansas City for having the audacity to ask one fundamental question. Would you put your children or grandchildren in these after school and summer programs if you had a choice, if you could actually buy something better? And because I wouldn't stop pushing, the consequence was I got fired. And that's how I ended up at the U.S. Department of Housing and Urban Development, started doing my doctoral work, and began to work in Chicago. And ultimately, after 11 years there, wanting to have greater impact is how I ended up at PolicyLink. So that's been the journey that I've been on, chasing one thing, which is to have greater impact, to make sure that even though I was successful in my career and from an economic standpoint, my sisters and many of my family members still struggle. And I don't want opportunity to be so random in this nation. And so that's what I'm pursuing. And that's what the platform that PolicyLink affords me.
And so you obviously believe that change is achievable and it could happen, and that it starts with each of us, that all of us have a role to play in creating systemic and positive change for our people. I bet you believe that if we are successful in shaping our own destiny, we'll end up having a positive impact on the destiny of others, even those who see themselves as adversaries to us right now, that we hold the key to their well-being as well as our own well-being, that they probably are inseparable at some level or another. What do you think?
I wholeheartedly agree with you. I mean, you know, we have a frame called the curb cut effect. And it says that when you help the most vulnerable, it has cascading benefits to everyone. You think about how those curb cuts were designed for folks who had different physical abilities and how we all take advantage of it every day. These are beautiful examples of ways in which paying attention to those who are in the most need should not be a point of argument. It should be the heart and soul of this nation. So I wholeheartedly agree with you, and that's the work that we do, is to try to find those curb cut examples every day to try to get people to see that our fates are inextricably bound. And centering those most in need does not necessarily have to take away from someone else.
Right, right. And so let's focus back then on this COVID-19 pandemic. And I heard you say that those who are in community organization, probably health professionals and policy people in our community, are not surprised. This and the consequences so far, the devastation that it's presenting to our people is also no surprise. And so the question is, what do we do? And, you know, Harry, you've written a couple of articles that sort of illustrate that impact of this virus on our people. Maybe go through some of the findings you've had already, Harry. And then I want to talk about Dr. McAfee, knowing that and hearing the numbers and how they impact us. How do we, what must we do to protect ourselves and to change policy in America in ways that value our existence, our humanity, our lives?
Well, in terms of what the data is telling us, this virus is killing us. And that's the short end to a long story. But the data is about 2.5, maybe even 3 weeks ago now, and I believe it was 3 weeks ago that I wrote the article where I noticed just through my Facebook timeline, a lot of the people, the early victims of COVID-19, kept having faces that looked similar to mine. And I noticed, at first I was saying, well, my timeline is biased because most of the people who share news on my timeline are Black. And so, but the sources that they were sharing from were sources that were not African-American news sources. These were the ABCs, the CNNs, and things of that nature, and the faces continued to be us. Then I saw in Milwaukee where at that time they had 14 total deaths in Milwaukee. And of that 14 total, or in the state of Wisconsin, and of that 14, 8 were Black from Milwaukee. And that was like a 57% clip. And Wisconsin is 6% Black. In St. Louis, the St. Louis American just last week ran a story where it said that all 12 of the victims in St. Louis City are Black. You were seeing it in Detroit, in New Orleans that you had mentioned earlier. We're seeing it in New York and New Jersey, and it's kind of a culmination of many things. One, the predisposition that many of us have to the underlying health conditions, diabetes, heart condition, asthma, things of that nature. Also, what you are seeing now, especially what they're seeing in New York, New Jersey area, is because of the occupations that many of us have, we're also doubly exposed because we're frontliners, so to speak, in terms of working in transit or working in the healthcare industry and all these other grocery store workers and things of that nature. So the virus itself is showing the vulnerability of Black people on multiple fronts.
That's right. That's right. Thank you for sharing that, Harry. It is, and this tragedy is that we do know what the path is. It starts with healthcare for everyone. You know, you can debate the policy solutions, but having affordable healthcare is key. That is a foundational start. But also having a social safety net that people can rely on, that actually wasn't intentionally designed, like the one in Florida, to not be able to take all of this demand because they didn't want people to apply. These are early, in the early, once we get through all of this, these are the things we got to get back to. Healthcare for everyone is a path forward. A social safety net where people have unemployment insurance and other protections is a path forward. I mean, And not even just to lift up our own work. If you look at a report from the Children's Defense Fund and the Urban Institute, the combined report called In Poverty Now, they list a suite of public policies that are evidence-based that would reduce poverty by 50%. So we know what to do there, but we choose not to do it. When it comes to frontline workers, making sure folks had childcare subsidies, they had paid sick leave, paid parental leave, that they were guaranteed a minimum set of hours, that they had a good wage, that they had transportation assistance. There are a whole set of policy solutions that we know would enhance the lives of frontline workers and allow them to actually spring into higher heights in terms of economic mobility. So there is not a dearth of solutions. There is a dearth of commitment to want to design this nation so that it works for Black and brown folks the same way it has worked for corporations, the same way it has worked predominantly for white folks. And unfortunately, what white America is not realizing is that now it is not working for them. I'm out here in Oakland, California, and when folks at Google and Facebook are struggling to say, I can't afford to live out here, you know you got a problem, right? And so this rugged individualism, this way in which we have this scorched earth, strip mining capitalism, it's not working for folks. And so it's time to just own that. There is no harm in owning it and for us to think about something different. This democracy has always been an experiment to improve. It started with radical imagination to form the government, radical imagination to kill folks, radical imagination to build this nation off of Black labor. And so it can exercise radical imagination when it wants to. And now is an opportunity for us to exercise that radical imagination to usher in the full promise and ideals of this nation for everyone, creating that just and fair society. The policy solutions are there. Now, community members listening to your show, we've got to rise up, join with the advocates on the ground, and actually demand that this will happen. You know, people like to say that the arc of the moral universe is long and it bends towards justice. They like to rely on that statement by Dr. King, but the reality is this: that statement is only going to be realized when we fight. This is not going to happen by trying to be nice. This is not going to happen because you're trying to make white folks feel comfortable with you. It's not going to happen because you can frame up the right data. Hell, if that was the case, this would already be done. It is time for us to own this nation and own our power, to assert and demand that our electeds will behave in the ways that work best for us.
I'm Al McFarlane. This is Conversations with Al McFarlane. My guest, Dr. Michael McAfee, President and CEO of PolicyLink, and talking about the challenges that we're looking at right now, sort of intensified by the COVID-19 challenge, but endemic problems that have existed, have persisted. And the question is, does the clarifying light and weight of COVID-19 challenge, inspire us to move differently, to move more aggressively, to move more boldly towards solutions? So, Doc, I wonder then, as you're speaking, do we too often look at white people as monolithic? And is the experience that we've had with white people, us as Africans, sort of revealing that there is a monolithic response to our situation? Are white people easy to coalesce around white identity and white identity politics, and not around the principles that they espouse and that they declare are the founding principles of our nation? Is there a reticence and a capability of discarding principles, moral values for the sake of supremacist ideology, positioning, fear that their advantage will be lost? And having said that, what do we need to do to disaggregate, to deconstruct the whole notion of whiteness as part of our path towards freedom, and ultimately our goal towards a freedom that is genuine and universal, that includes them, but eliminates their history and their capacity to be destructive to themselves and to us and to the world? Big question. What do you think?
I think that white folks are as beautiful and diverse as all of us.
Mm-hmm.
And we all are infected with this deadly construct of whiteness that you talked about. And it plays out in very different ways. It has many of us hating ourselves. It has many of us doubting our capabilities and our ability to influence things in our homes and in our societies. It has white folks passively participating in a system that is killing them as well. It has allowed them to passively sanction the killing of Black and brown folks. And so the construct of whiteness is what must be overcome. I know plenty of white folks who are down and are working to advance equity. Same way I know plenty of Black folks who are, and plenty of Black folks who don't want to have nothing to do with this work. And so the diversity and richness of this nation is found in every population. But the thing that is hurting us is we can't stop centering whiteness. And here's what I mean by that. We're always weighing, should we do something based on how white folks will feel? Will white folks feel comfortable if we move that policy? Will white folks feel comfortable if we demand X? And we've got to center something else. This hierarchy of human value must be torn down. That is what whiteness has created, a hierarchy of human value. And whether you're conscious of it or not, it exists. And that is why you can't get beyond these problems. It is the operating system for this nation. Whiteness is produced a hierarchy of human value, and that hierarchy of human value says that Black and brown bodies aren't worth saving, generally. And folks have generally been okay with, just like with the virus, if that virus jumps host to poor white folks and kills them as well, as long as it doesn't get to the rest of the white folks. And that is the problem right now. And so I think you get beyond it by us modeling a different path forward. Whatever we create must not exclude white America. Whatever we create must be all inclusive. Whatever we create must be liberating. And that's what I love about what you see for the movement of Black Lives Matter, that platform. That's what I love when you look at what the day workers are putting together, what the farm workers are putting together. When you look what folks who work in our homes, healthcare workers, there are platforms out there that are liberating, that center actually everyone. And that's what we got to get to. Now, the challenge for us all is that to do that, and you see so many amazing leaders stepping forward and taking the risk, is you've got to be comfortable suffering a little bit of loss. You know, I'm standing on the shoulders of Black and brown leaders who have paid a tremendous price for me to be able to be on this show with you today. And how tragic it would be if I prosecuted what they had already won for me. The challenge for us now is to fight to redesign this nation. It is to center everyone and to not allow, not to tolerate a subpopulation of white folks who are hell-bent on designing a nation that is just dangerously oppressive. It is just harming everyone. And it hides under the mask of bipartisanship. We can't be bipartisan if you're going to continue to oppress me.
I think we're closer to that than we want to admit, Dr. McAfee, because, you know, the president gets on and talks about early on opening up the country. And the idea maybe behind that sentiment or his aspiration is that maybe the ongoing and hopefully diminishing impact will be centered in Black communities, and that white people can get on with the business of creating the Make America Great Again agenda. And they want to keep their money moving, keep their movement moving, and he wants to have that going into the election. And so, you know, the fear is that there's a willingness to consider Black lives and poor lives expendable. And so you mentioned that remains a problem until we advance a different narrative. Let me ask you, how would you advance a different narrative? What ought we be saying and doing in terms of organizing and articulating our interests as true American interests and as true human global interests? How do we do that? What are you saying?
I'm saying I don't even have to think about it too deeply. I just have to join, because in every city across this country, there are advocates on the front line who are already showing us the path forward. There are Black and brown leaders in our communities that have been winning. The fight for 15, Black and brown folks. No cash bail, Black and brown folks. On any issue you want to talk about, water, infrastructure, etc., there are folks in our community that are leading the way. Our job is to join with them and stop thinking that those of us who like sit in my seats, these think tanks, that we actually have the solutions. The solutions are found in those communities, and that's what needs to be lifted up. Now, the problem is we don't listen to those folks. And then we turn our nose up with them after we haven't listened, and they finally go to the street to be heard. And if we're going to move forward, it's like Black and brown folks who live quite comfortably. We also can't be afraid of our brothers and sisters who have been holding it down for us in the streets. It's time to join with them. It is time to join with them. There is a path forward. And that path forward is to join with those who are suffering, those who are willing to fight. They have the solutions. The question is, will you join? Will you suffer a little loss in order for your family and future generations to actually gain and to be liberated? That is what I'm most excited about. Don't have to find the answers myself. I just simply have to have my eyes open, my heart open, and be willing to join.
I say you're going to suffer the loss. The question is, will you take the risk?
That's right.
Proactive, because the loss is coming to you, whether you like it or not.
Whether you like it or not.
Let me introduce a colleague of mine and introduce you, Dr. Michael McAfee, to my colleague and my brother, Tom Gitta. Tom Gitta is the publisher of the McFarlane, which is a monthly, soon to be weekly, I think, publication serving African Americans here in Twin Cities. Tom, thank you for jumping in the conversation. If you hear me okay, introduce yourself and join the conversation.
I think we need your microphone turned on.
Oh yeah, I think I was on mute.
Yeah.
Can you hear me?
Yeah, I hear you.
Okay. Thank you for having me on.
Pleasure to connect.
And so just jump in. I mean, we're both, you and I, owners of newspapers. When we have this conversation, you bring another dimension to it, and you bring the question of the impact of immigrant communities, immigrant African communities, and the challenge that we have as American-born Africans, and that you bring as a continental-born African who's an American now. How do we meld and determine what our common interests are in light of this conversation?
Well, thanks again, Al, and hello, everybody.
Hello.
Yeah, I mean, I think, the common denominator here is that all of us want to make our lives better, for sure. And how do we do that? There's a variety of ways to do that. So first of all, like what is going on with the stimulus stuff and things like that, you find a lot of the African immigrants, this might be the first time, other than their immigration status or, dealing with the government for immigration matters, a lot of them that have been running businesses here, this might be the first time that they actually need to ask for some kind of help. And, so it's been kind of a challenge actually for many of them to be navigating the system, because they thought they had it all made up. A lot of some of the businesses have just been in business maybe 5-10 years, and the only time they interact with the government is, for different applications, approvals, and that kind of thing. So now they're told, oh, you need to do this, to apply for XYZ loan or assistance. And, with African immigrants, it's kind of like now they say, when white America catches, cold or, the rest of the people catch a flu, it's even twice that for the immigrant community. Because they have to deal with the usual stuff, obstacles and difficulties, but then now they also have to, be thinking how their businesses are going to survive, where the next meal is going to come from. So, there's that, additional burden that we have to bear, and but we're pushing along.
How do you advise and suggest, and what's your experience, Dr. McAfee, in how we develop a cohesive and comprehensive strategy that involves African Americans, the legacy African American community, and the newly or more new Americans? My father is is a Cuban-born Jamaican, so I grew up in Kansas City as part of a Jamaican community. Our family lived, probably you know my neighborhood, 28th in Brooklyn and 24th in Park. My auntie was a nurse RN. Three of them were in Kansas City. So they probably knew your parents, you know. But the question of being immigrant from the Caribbean and part of the Black community has always presented both a challenge and an opportunity. So the question is, how does that play out right now? And what is the strategic power that we can discover between us and among us? And that is not only among those of us who are here, but how do we, with intention, embrace and understand the power of our presence on the planet? And I'm leading to this question in the spirit of your comment of our people having the courage to center the discussion, the dialogue around justice, truth, and humanity, and not around white people. What do you think?
This is why I said that the construct of whiteness has infested all of us. If you can't see the humanity in our immigrant brothers and sisters and see our fates as joined, you're manifesting the very thing you don't like when it's done to you by white folks. This inability for us to collaborate, I get why it's there, but if you were to say, well, what's the work for our generation? It is for me to acknowledge and to be able to hold, you know what? I must love every single person in our community. And the immigrant population is just as important as me advocating for my own issues. If I don't hold that consciousness, it's too easy for us to be divided. It's too easy for us to be factioned off and bought off. And so for me, that is what transformative solidarity ultimately looks like, is that I can hold the interests of groups that I may not be a part of. That is how you start tearing down the walls of whiteness, by being able to join, by being able to listen, by being able to understand the struggles, the needs, the hopes and aspirations of other groups. And when you do have power, to use it in service of those folks. That is how I see being able to move forward.
I'm Al McFarlane. This is Conversations with Al McFarlane, our special broadcast, connecting remotely, honoring the challenge of COVID-19, the staying our distance, operating from home. That was the voice of Dr. Michael McAfee, who's president and CEO of PolicyLink. And we're talking about the impact of COVID-19 and other disparities on our people, on Black people here in the United States and beyond as well. Also on the call, my colleague, Tom Gitta, the publisher of Mshali newspaper here in Twin Cities, and my colleague at Insight News, Harry Colbert Jr., the managing editor of Insight News. We're joined now by Senator Tina Smith, who represents Minnesota in the U.S. Senate. So Tina, thank you for jumping on the call, first of all. But we're having a rich conversation that challenges the depth and the rigidness of white supremacist thought and how it's baked into public policy and how we have to be, I think, clearer, stronger, and more confident in our ability to speak our truth and not be afraid of recrimination, I think it is, or needing the benefit and the rubber stamp of a system that has opposed our benefit forever. So that's the background of the conversation. You've joined us. Thank you for joining us because you want to talk about COVID-19 as well. And so I wanted to first ask you about the $2 trillion investment. What's happening with that, and how do communities benefit? How do Black people in particular benefit from the stimulus package and the relief provided by the federal government? And well, gentlemen, jump in whenever you want to. This is a conversation.
Thank you. Well, thank you, Al. It's so great to be with you and Harry and everybody on the call. And let's see if we can't bring these two conversations together, a conversation about what we are doing to address the terrible scourge of the COVID-19 virus, and also what we need to do to address the systemic racism in our community, because these two things are joining in painful and deadly ways with the coronavirus. So, you know, there's this idea, some people say, oh, the coronavirus affects everybody equally. Everybody, you know, nobody is immune. It affects everybody equally. But we know that that's not the case, that this virus is having particularly grim impacts on people and on communities that have been struggling with systemic discrimination for hundreds of years. We can see that every single day. And so my challenge as Minnesota's senator is to work to address that as we seek to respond to this public health and economic crisis. And that's what I'm working to try to do. Let me just talk about a couple of things specifically, what that looks like. Okay, so in the COVID-19 package that we passed, we included direct cash payments to individuals to help them survive this economic earthquake. And it's incumbent upon us, therefore, to make sure that those cash payments get to individuals that might not have you know, an online relationship with the IRS, who might not have a home that the check can be mailed to directly, that might be living with domestic violence and have to actually hide their home address, that might have adults living in their household that are dependents and are not included in the bill so far. Those are some of the examples of how we need to think about how this bill can be implemented in ways that benefits all of us inclusively, and there's a lot of work to be done there.
And so you've added some particular things to the bill to protect parts of the community. Talk about that, if you would.
Well, here's one example. We know that there are many families that live together that might have an adult who lives in the family that is a dependent on the family. It might be an adult who lives with them, or it might be somebody who has lives in a family who's over the age of 17, who has disabilities, intellectual or physical disabilities. Well, the way the bill is written right now, those individuals don't get the benefit of the cash payment that others would get the benefit of, and that's just as wrong. We have to fix that. That's something I'm working on with Representative Angie Craig. And then another thing I'll just mention is that the bill, we don't do nearly enough that we should in this piece of legislation to make sure that the small business benefits in the bill are percolating to small businesses, minority-owned businesses, women-owned businesses. That's something else that I am working on really actively right now to fix.
Michael, what do you want to see your Congress, your Senate and House of Representatives do to support Black issues and our community? And Tina, let me say before he answers that we've been talking about our belief that addressing the challenges of the most vulnerable really means addressing the entire nation and the entire world. So the strategy is inclusive and open, not one that is marginalizing or dismissive or that pits one group against the other.
Yes,
Dr. Michael?
Exactly.
Yeah. I think Senator Smith gave us two really good examples of listening to those most in need and crafting policy solutions. That is actually what is needed. And the more we can join with our elected leaders to actually do something that we've not done in past recoveries, center the most vulnerable and ask one fundamental question: are they actually better off when we get on the other side of this? That should be the accountability standard for us, right? Can we ask that question and answer it with a resounding yes? And it starts with paying attention to how they live their lives, what some would call the user experience, and to do what the senator just did. Design stuff that really works for folks, the way they live their lives. Mm-hmm. And the other would be to make sure that we don't let all the money out the gate without really good ways of having some accountability controls. I thought folks wanted accountability for taxpayer dollars, right? That should be a good thing. If we're not delivering, we shouldn't get the money. And so you take small businesses right now. minority-owned businesses. We know many of them don't have pipelines into the traditional banks. We know many of the CDFIs, et cetera, don't reach into those communities. And so this is a perfect example that is right now, small businesses, nonprofits are working to get immediate relief. Those dollars could wash right over our communities and miss. So if we take the senator's example and continue to see where things aren't working and offering these fixes, we will get there. That's what has to happen. So if you say, what should we center? We should center the folk, those working folks in America who are struggling, and we should push ourselves to be accountable for actually really moving metrics that can show us that we've improved their lives.
Senator, here's an Al McFarlane statement or truism. I often say, they get the money, we get the misery. And people know me for saying that. And what I mean, obviously, is that when we analyze and do the research and assemble data about the impact, not only of this calamity, but the data that reveal a panorama of health, wealth, education, engagement, inclusion, disparities. All of those exist, and all of those make it our communities more vulnerable and give a clean pathway for the devastation of Corona, right? But too often, if we raise our voices with solution and with a request, even a demand for the resources we need to be part of the solution side of the equation, we are dismissed and not responded to. White people are trusted, and somehow we are not. That's what I think. What do you think about that, Senator Smith?
Well, I think too often, I completely hear what you're saying. And too often what we do, we meaning the sort of majority culture, is we will show up in a community and we'll say, hi, we're here to help. And we know exactly what to do to help. And so listen to us and we can tell you how we can solve your problems. And it is a position that is born out of lack of understanding at best, but at worst, it's born out of the idea that I just know more. And we have to break through that. I mean, I feel like my responsibility is to, I always say, I think it's because I come from grassroots organizing myself. The best ideas are going to come from the people that are living the lives. And you, if you have you got to listen to that, and you got to understand that you have something, I have something to learn every time I engage in one of those conversations. It's a lot easier to show up and say, oh, I think I know everything, but it's just almost always wrong. And so that's what I am trying to do right now as we live through this, as we attempt to survive through this, as I said, an economic and public health earthquake that is shaking the very foundations of our communities. And if I can get the ideas that folks in communities have and then lift them up, I'm going to be a better legislator. That, to me, is my job.
Senator Smith, we talked earlier about the impact in both cases and deaths in Black communities. Do you have any information about the status of Minnesota? I know the last I checked, we were at around, Harry, correct me if I'm wrong, 1,500 or so infections. Is that what the number was?
Right now it's at 1,695 in terms of infection. There's 79 Minnesotans who lost their life to the virus. What I'm trying to find is the data on the ethnic breakdown of those who have passed away. We have the ethnic data of those who have contracted the virus, and it's 67% Caucasian or white and 10% Black. And that 10% equals out to 169 cases, with about 4% Asian, 2% other, and 16% unknown.
Yeah.
So I question that we've not drilled down, because most of the people of color in Minnesota live right here in Hennepin County and Ramsey County. And when I checked a couple of days ago, Ramsey and Hennepin County between them had about maybe half of the state's infections. Is that right, Harry? Do you know? Or close to half, maybe a third to a half.
Yeah, Hennepin County has 588, and I believe Ramsey County has, I have to check on Ramsey and get back to you very shortly, but Hennepin County has 588.
So if it's 40 to 50%, but that's where most people of color live, our question is then if that universe is just Twin Cities or the metro area, and what is the rate of impact on communities of color? Right now we're saying, oh, in Minnesota it's 4% or 3%. I think the scale of the geography skews the data. And I think that Black people in Minneapolis and St. Paul probably have something to worry about.
Well, I think, Al, that the big point here is that we really don't know that much yet about this. And the Commissioner of Health in Minnesota, Jan Malcolm, who I have a ton of respect for, would say if she were on this call, there's parts that we don't know about who actually has been infected. There probably are people who have died of the coronavirus. We don't know who they are because they were never tested. They were never included in any of this data. And so that is, I think, a really sobering and saddening moment. But what we do know is that in other parts of the country, we are seeing dramatic disparities in individuals that are being sickened by coronavirus and people that are dying because of coronavirus. And you can see this in Chicago and Detroit, in southern states, and it is a catastrophe. I think it is outrageous that the Centers for Disease Control, the federal public health entity, is not yet collecting systematically data on the demographics of those that have been impacted by the coronavirus. And until you have the data, until you understand what's happening, you really are never going to be in a position to address it. And we cannot be afraid of that information. We have to look at it and then we have to address it. And we have to follow where it leads in terms of the disparities in our healthcare system, the lack of just sort of being heard in our healthcare system for people of color, the impacts, the lifelong impacts of poverty and trauma and racism that affects underlying health conditions, the lack of opportunity, all of these things come together and we have to confront them. And you said something a moment ago that really resonated with me because, I've always was mentored by Paul Wellstone, and Paul always would say, and I repeat it often, that we all do better when we all do better. And as I was listening to what you were saying, this virus, this pandemic is reminding us that we can't all be healthy until we are all healthy. It comes together in that way, or it never comes together. So one of our, some of us are not better than any of us when it comes to the need that we all have to look after the health of all of us. And I hope, I'm always looking for hope in these moments. I hope that will lead us forward into a better, broader understanding about how we are all in this together. And we will think about what that means then in terms of how we build back better and stronger than we were before this terrible thing happened.
Senator Smith, thank you so much for taking the time to join us. We appreciate your work and your leadership. We're going to close in about 90 seconds. I'm giving notice to the station to be prepared for the handover, but I want to use this last 90 seconds to give you, Senator Smith, and you, my colleague, Dr. Michael McAfee, some final words, recommendations, advice, counsel for our community. Senator Smith, what should we be doing to make sure that we hold ourselves and our government accountable?
Well, what I would say to everyone here is it's not exactly what you're asking, but what I think that we should all do is remember that as we are trying to practice the physical distancing that will help us be healthy and allow us to move forward, to remember that that is an emotional distancing, that it is so important that we stay connected emotionally to the people that we love, to our communities. That's what we need to do right now to take care of ourselves. And I hope everyone is taking good care of themselves as best you can, even if you have to be out working in this dangerous environment.
Senator, thank you so much. We'll be inviting you back regularly just to keep the conversation going. Dr. Michael McAfee, President and CEO of PolicyLink. I got about 35, 45 seconds. Top of mind, recommendations, thoughts.
And when we come through this, absolutely continue to take care of the immediate human needs right now, but begin to think about how do we do right by frontline workers. There is an amazing report that we've issued on how to support frontline workers with 23 policy recommendations. If you go to PolicyLink and Frontline Workers, you can see that report. I think this is an opportunity for all of us, no matter what race that we are, to think about how do we design a nation that works for everyone. and to take the lead of some of the good policy solutions that are coming forward in these stimulus packages and continue them. That is the work for our generation, to design a nation where everyone in this country can participate, prosper, and reach their full potential.
And I think, Tom, you had a quick question or comment.
Yeah, just a quick comment for Senator Smith. Check with your assistant. I think her name is Mai. She has some information that was sent away by some of the African Healthcare Business Owners Association regarding immigration and some workers that need some visas to work or something like that.
Thank you.
So
I
check
will.
with her. Yeah.
Listen, this has been a great conversation. Thanks for listening here on KFAI. Thanks to my colleagues, Harry Colbert and Tom Guitar, for joining the conversation. Thanks to Senator Tina Smith and to Dr. Michael McAfee. I'm Al McFarlane. This is Conversations with Al McFarlane. We'll see you right here again next week. Back to the station. Thank you.
Thank you.
Thank you all.
Thank you all.
Wonderful conversation.
Really appreciate it.
Yeah,
Thanks for.
so much.
Yep.
Yeah, sincerely.
Good day.
Yeah.
Bye.
Bye.
Goodbye. And I think the station should be back on now. Let's see, double check.
Yeah, I'm gonna end here.
So Harry, good show once again. And Tom, thank you for joining.
Yeah, thank you.
We'll see when the station picks up, right, Harry?
No, I don't see when they pick up, so they probably have already hopped off.
Okay, because they're muted here. But,
Yeah.
okay, great.
All right.
So they'll take it from here, I'm sure. They should be there in the studio. But Tom, thanks, man. Good conversation.
Yeah, thanks for having me over.
And this technology is very nice. And that's what we're going to try to do this every day. I mean, this is something we can do, you know, like every day. And I think as early as Friday, Harry, if we get it organized.